Everyone deserves access to quality health care. Across Seattle, Neighborcare Health has been the access point to comprehensive medical, dental, and behavioral health care for the most vulnerable people in our city. Of the more than 48,000 patients we care for each year, many come from homeless situations.
I feel that as human beings, you need people to fight for you when you're unable to fight for yourself.
People often misunderstand our patients. They judge them by their outward appearance.
Neighborcare Health currently has 5 healthcare programs to care for Seattle's homeless population, while our family team provides mental health and nursing services to women and children in homeless and domestic violence shelters. Our homeless youth clinic provides medical, naturopathic, dental, social work, and mental health services to homeless individuals 14 to 24 years of age. In addition, our housing health outreach team goes to various permanent supportive housing units in downtown Seattle, partnering closely with Evergreen Treatment Service to provide outreach, nursing, and mental health services to chronically homeless, addicted adults. We also partner with Evergreen Treatment Services Reach Team, providing 2 nurses to join their case management team to deliver medical care to chronically homeless and addicted adults living on the street and encampments throughout Greater Seattle. Finally, Neighborcare's newest homeless program is the Ballard Homeless Clinic, which provides mental health, nursing, and medical care to homeless adults.
The young people that I've worked with, they teach me a lot about them and the struggles that they've had, and they also teach me about myself. They remind me every day about the strength that people can develop out of hardship.
Remember that these are people just like you and I, just like our mothers and fathers and brothers and sisters, and they're humans. And just like our families need a little bit of love, so do they.
You truly have to meet the client in this position, in this population, where they're at.
You're so lucky to work with the people that you're going to meet, because they are living in a different world than the rest of the people that you meet.
We interact with people who have been, traumatized in some way, or they're carrying around a lot of pain. And to be able to alleviate some of that is really rewarding.
The medical details sometimes come out over months and months, and sometimes don't even come out, but there's trust established as I get to know people.
The best part of my job is helping people to learn to take care of themselves, or trusting themselves enough, or trusting me enough to access the medical care system again.
The best part about my job is getting to see people accomplish small increments, small successes.
We can't rescue a lot of people, but we can offer them hope, and we can take steps, often small steps with them, and that if you're able then in hindsight a year or 2 later to look back, there's amazing progress that has taken place with just very small little steps, not giving up over time.
My main goal for people is to make them have a good quality of life, and I feel like that is impacted by my relationship with them.
I think we do phenomenal work. I think really hearing how the staff really stop and take time to slow down and find the person and connect with that human being.
I think it's wonderful when you can bring all these different people together who everyone has their own piece of the work, and we bring it together to make this beautiful program function.
Neighborcare Health's current homeless healthcare programs continue to focus on providing primary healthcare to homeless populations in Seattle, including the homeless families and youth. But the sustainability of these programs largely depends on the generosity of individual donations and the time and talents of volunteers. Visit us at www.neighborcare.org and click on Programs for Homeless Patients to learn more about supporting these programs and how you can contribute to your community today.